I'm so happy to welcome Dr. Nabila Noor, a friend and colleague who has incredible expertise related to women's sexual function. But before we really get into any of our topics, would you like to introduce yourself?
Yeah, well, thank you so much, Dr. Stockwell. Very excited for our conversation today. So, for your audience, my name is Dr. Nabila Noor. I'm a board certified and fellowship trained urogynecologist. I currently practice in Allentown, Pennsylvania, where I have a very busy practice. I think a lot of the times I do like to take a minute to kind of talk about what urogynecology is, because a
Perfect.
lot of the times people are like, wait, what? Are you a urologist, a gynecologist? So, urogynecologist is actually a subspecialty of OBGYN. So, my background is actually in obstetrics and gynecology. So, what that means is after medical school, I did 4 years of residency in obstetrics and gynecology, where I took care of women pretty much at every stage of their life. So, pregnancy, afterwards, younger women. But then I wanted to specialize in urogynecology, where I essentially take care of women with pelvic floor dysfunction. And what that means is, it's a whole host of things. So things like urinary leakage, women who feel like they have a lot of urinary urgency, people who can control stool. There are things called pelvic organ prolapse. So there's a whole gamut of things that's, surgical, non-surgical, really related to what our pelvic floor involves, essentially.
It's such important work, and because my audience includes some of the most highly educated people and some people who have no reason to be particularly informed about things that doctors know, will you go ahead and define what the pelvic floor is? I feel like pelvic floor therapists, it's more in the regular vernacular than it used to be, but I don't presume that everyone knows exactly what that means.
Yeah, no, I think you're absolutely right, because it's not a thing or part of a
It's not
body
like your
that's very
nose. We don't,
obvious.
can you
Yes.
imagine in childhood with our babies if we did, head, fingers, nose, pelvic
Muscle
floor,
that
and
you can be like,
toes?
"That's the muscle, that's the pelvic floor muscle." So no, I think that's a very good starting point, right? So our pelvic floor is essentially a group of muscles and connective tissue, which essentially forms the base of our torso. So if you think about it, I call it the floor of our body. So that pelvic floor is essentially supporting all our pelvic organs, which could be the uterus, the bladder, the rectum, the intestines. And so pelvic floor dysfunction, when we say that, in simple terms, all it means is that your pelvic floor muscles and the contents that it's supporting essentially are not functioning the right way. Why? There's a whole host of reasons, and we may get into that. But as a result, what patients feel or what women complain about are things like we talked about, like urinary urgency, not being able to control urine, urinary leakage, bowel issues, pain with intercourse. That's a big one. Pelvic pain in general. So it can kind of, represent itself in various different ways, which, as you can imagine, can affect, not only our health and well-being, but how it relates to intimacy.
For sure. And actually, you're saying that makes me think of another question that I think is important that I don't hear really spoken about, because I think most of us in some basic way know how our muscles work. At a minimum, we know that if we go to the gym and we start with 5 pound weights and then and we do our bicep curls and or work our triceps, whatever it is that we're doing. But I'm just going to use my arm muscles because they're in view on the Zoom
You
screen
can
for
see
anyone
it.
watching on YouTube. Yeah. So, okay. So we do 5 pounds, 10 pounds. If we keep going, of course, we can lift 180 pounds. In other words, the options in the general population, what we think about with muscles is that either they're headed towards atrophy, meaning weak and unused, or
Mhm.
they're not necessarily headed towards hypertrophy, but they're being built and growing stronger and stronger through specific usage. The pelvic floor is not as binary or simple as that, where
No, it
either,
isn't.
if it's weak, you just do particular movements and then it gets stronger and then you can do the things that those muscles make possible. Will you talk about how the pelvic floor musculature really doesn't fit that model of thinking?
Yeah, no, I think you make a very good point, right? Because, first of all, the first difficulty, as we alluded to before, is it's a muscle that we don't see, right? It's very easy to explain to somebody, here, do this, and that's how you build up your biceps, or do
Because
this,
there's
that's how you
immediate
build up your abs,
feedback.
right? Absolutely. You see it, you can see the movement, you can understand the movement, you can see the results. So that's the first difficult part about the pelvic floor muscles, right? Because we can't see it because it's a muscle that's inside, right? It's inside the pelvic floor, so inside the vagina. So, when we talk about, like you mentioned, like strengthening those pelvic floor muscles, because those are some of the basic things or some of the initial treatment options that we offer women who have these pelvic floor dysfunctions. The second difficult part is, well, am I using the right muscles? And that's a hard concept to teach patients, right? Because, well, one, you can't see it. Well, then how do you measure it, right? So there are some tricks and, tips that we talk to patients about. And I think that's where working with the pelvic floor physical therapist can be really helpful, because these are trained therapists who, really knows how to take care of women with these kind of dysfunctions. It's like, I tell patients, like, think of it as a doctor, right? When you have a heart problem, you go to a cardiologist. When you have a stomach problem, you go to a stomach doctor. So there's a reason we have specialties. So that's the other important point. And then the third point I'll mention is, I hear my patients talking about, whenever I mention pelvic floor exercises or, strengthening their muscles, that, oh, Dr. Noor, I'm doing Kegel exercises. And that's great. But just like any other muscles, when the idea is not just to contract those muscles, you also need to know how to relax those muscles. An analogy I like to tell patients is, you want that muscle to be a yoga muscle, meaning like it's flexible. You don't want to be a bodybuilder. Like, you want your pelvic floor muscles to be like a yoga muscle, like a yogist, right? It can stretch and it can relax and it can contract the way you want it to. It's not just flexed and tight, because then patients can have other issues, which is like, pelvic pain and pain with intercourse, because those muscles, when they're really tight, can be a whole other set of issues that, that I often see my patients having sometimes.
I'm cracking up over here because I'm thinking of like a super buff guy where, like, you can, like, if you put something on those biceps, it bounces off because it's so
right.
like well developed. And I've never thought about it this way until, my imagination is wandering while I listen to you speak.
You're picturing it, right?
With the pelvic floor, I think we think, if we want a tighter vagina or we want to avoid peeing when we do jumping jacks, then you just do more Kegels. So I'm just making the same point you're making, but in a humorous way, that we don't want to just do more Kegels and end up with a pelvic floor musculature that's
you don't want to be contending for that bodybuilder contest, not with your pelvic floor.
I love what you're saying. Like, what you want is to be a yogi, a genital yogi.
Absolutely.
Genital yogi master.
There you go, right? You want that muscle to do what you want it to do. But, we joke about it, but it is a common problem, believe it or not, in a lot of young women, especially young girls who have been like a gymnast, right? Or, have been an athlete all their life. We see it very commonly. Like, I have patients who are in their early 20s, right? They come in and they have like the perfect fit body. You can definitely tell just looking at them that they exercise. And when I try to do a vaginal exam, like, their main complaints to come to me is that they have pain, right? Even putting in a tampon is just so uncomfortable. Like, forget vaginal penetration. Like, they're just so uncomfortable. And the reason for that is because all their life, like, some of these girls started when they're maybe 3 years old, right? All their lives, they've been trained to just basically tighten their core, like, hold it, like, you're just tightening everything, which again is great. But if you don't know how to relax those muscles appropriately, what happens is that chronic tension that builds up in those pelvic floor can really develop some trigger points, and the nerves can get very sensitive. And so these women later in their life, as they try to be sexually active, or they're trying to engage in intimacy with their partners or trying to conceive, they notice that, why am I having all this pain? And it doesn't make sense. But it's because of that. And so the treatment for that, believe it or not, is something we called myofascial release. So it's basically the opposite of Kegels. Like, you're learning how to relax those muscles. And sometimes when I tell patients, they're looking at me like I have two horns. Like, what? Are you just making all that stuff up? I'm like, no. And then, they do the PT and they see the results and they're like, oh my God, that is so amazing.
Yeah. And, you're talking about gymnasts, I assume, girls who ride horseback, do ballet, all kinds of core building activities. I never was especially disciplined in any of those things. I never did gymnastics or ballet. I did ride horses, but in a very casual way. And so, like, I have never had the kind of athletic build that anyone who does those things has. But I had very big babies, and whatever you're picturing, it was bigger than that. And my biggest one was 12 pounds. And
You deserve an award for that.
well, I have, that's a funny thing. People always are like, oh, it's so big, but I delivered vaginally without any, totally naturally. And those babies, they eat well and they sleep well because they're very formed. So, once you birth a baby like that, you get the prize right away, as long as,
Yep.
there's no conditions that contributed to the large size that make things more complicated. But anyway, that's kind of
Absolutely.
beyond the scope of where we're going. But the point is that I personally went to a physical therapist. It was a kind of an edgy thing to do. I'd certainly never heard of pelvic floor therapy. I'd never heard of that in my medical training. And after having an 11.5-pound baby, that was the one before the 12-pound baby, I went to the pelvic floor therapist and was just astonished that I actually was, we'll say, strong, and meaning my muscles were contracted, but I could not relax them. And it was such I just want to say, to kind of normalize that, like, I thought I was mush in that region.
Yeah.
But I wasn't mush. I was like super contracted, and
You're very
so
contracted.
much of every session I had with the pelvic floor therapist was to learn to actually relax. And I'm sure that is why you're talking about, the genital yogi master really spoke to me, because I just was so surprised to learn that through being a patient.
Well, think about it. You're a physician, and, I'll be honest, before I did my fellowship, which is a subspecialization, I had very little understanding of what the pelvic floor muscle is also, right? And so, to expect the general public to understand it and understand the nuances of it is a lot. And I think that's where it's our responsibility, us as a group. So, of course, me as a urogynecologist, and, we work with the physical therapist to really help educate women. And one of the things, like one of my pet peeves is, and actually one of the things that frustrates me as a urogynecologist is, why is it that women find out about me or my specialty only after they've had a traumatic birthing experience, or they're suffering with a pelvic floor dysfunction? Why am I not talking to the 20-year-old or somebody who's thinking about pregnancy, so that they actually go into this knowing what to expect, what's going to happen to my body, what are some changes, and what can I do about it, right? It's a conversation I have with my friends and family. And so, I take it for granted that everybody knows, but people don't. And like I said, I recently saw a young woman who, had her first baby and then had a bad laceration, which didn't heal. And then she ended up with something called a rectovaginal fistula, where now she's essentially, so it's basically a false tract, as you know, that forms between the vagina and the rectum. And now she's having stool that's coming out through her vagina. And imagine, it's a new mom. She's stressed. She's going through all the hormonal, like imbalances. She's a new baby. She's trying to adapt. And now she has this. Her mental state, emotional state is all over the place. And she had no concept that this could even been a possibility, right? Of course, this is not common, thankfully, but my point is, like, these are conversations that we should have with women, that, the perfect birthing experience is amazing, but remember, these things can also happen. So let's prepare you for it.
Yeah. And let's transition in the last part of our conversation, because yes, there are all the circumstances you just described, but I think it's also just important to say at every phase of life, well, let's just talk specifically in every phase of the life of a woman in a long-term committed partnership, that things can happen such that she avoids intimacy. And yes, there are all kinds of things that can happen in the relationship and related to her libido. And I have lots to say about that we're not going to address in this conversation. But we talk from a urogynecologist perspective, some of the things that might make someone avoid intimacy, and they may or may not realize that's why they're avoiding it. Like, it can be unconscious, and it can be also just, I don't want to have that experience, so let me avoid it. What are some of the things that you see which the result is a lack of intimacy in the marriage? And for my audience, we know that's bad news. We don't need to explain that.
Oh, absolutely. I mean, I see it all the time. I mean, as I said, especially in my specialty, I do see a fair amount of women who have problems of what we call, urinary incontinence, where they're not able to control urine, and, urinary or bowel incontinence, what we call fecal incontinence, where they're not able to control stool, and even something called pelvic organ prolapse, where essentially because of the weakness of your pelvic floor, you have your pelvic organs, which could be the uterus, bowel, bladder, essentially pushing through the vagina. And what patients feel that, oh my God, there's a ball coming out through the vagina, right? And these are a lot of these women start noticing years before they come to see me, right? Because maybe they had their child, and right immediately after, here and there, they'll have a little leakage, and they were always told that, oh, it's common in the postpartum period, it will get better. And then fast forward 10, 20 years, they're going through menopause, it gets a little worse, and then they're told that, oh, it's menopause, it will get better. And so before they know it, they've been suffering with this for 30 years. And subconsciously, it's bothering them. But in their mind, okay, everybody's telling them it's normal. And they don't realize like they're avoiding intimacy, they're avoiding social gatherings, they're isolating themselves, they're, subclinically, they're depressed, and yet they don't know it. So by the time women come to see me, the first thing they talk about is, well, I'm leaking, and, we're kind of digging deep into it. And so often I have women breaking down about like, this bladder is dictating my life, right? Like nobody understands me. My partner doesn't understand me. And even if they're the nicest person, this is not a conversation you want to have with your partner, right? No matter how sweet and how accommodating they are, women have a lot of body image issues, and add to that this whole variable. And now they're super self-conscious, right? Like, what if they have a little bit of leakage when they're being intimate? Or what if they have leakage during penetration? Or what if they have to go to the bathroom? Like, these are not things. And when you're thinking about all this, I mean, you can imagine how that affects you trying to feel very sexy and trying to really get into the mood. Doesn't quite
And
work very
also
well.
being relaxed is required for the most erotically
Absolutely.
fulfilling experiences. And
Absolutely.
for a woman who's navigating this, being relaxed just immediately puts her at risk for whatever her circumstances are with whatever
Absolutely.
substance to
And
just come out
right.
on its own.
And the good news is, a lot of these issues are so treatable, right? Whether it be with surgery and even some non-surgical treatment options. And like one of my favorite moments is when my patients come back to the office, like after we've treated them or we've done a very simple surgery, and they're like, I can't believe I waited for this long. And they're just so grateful because they know it's going to improve so many different aspects of their life, not just the physical component of it, but like we talked about, the relationship, the self-confidence, the body image issue, where they can just live their life and enjoy the things that they used to enjoy. So that's very satisfying and fulfilling.
Fantastic. So you are such a wonderful advocate. And so for anyone listening, of course, they can try to find a urogynecologist nearby. There aren't urogynecologists in every street corner or in every clinic, of course. But for those who are lucky enough to live in driving distance, or I suppose somebody might fly, but if someone is in a position to see you in Allenton, Pennsylvania, will you share how people can find you and also on social media?
Absolutely. You can always just check me out on my website. So it's drnabila.noor.com. And I'm also actually very active on social media. So I have a YouTube channel, Dr. Nabila Noor, Instagram, Facebook, all Dr. Nabila Noor. So it's easy. And, like you said, if you're in the Allentown or the Lehigh Valley area, please look us up. We're happy to see you and take care of you. But again, no matter where you are, the first thing, and I'm a big proponent of this, is start the conversation, right? A lot of the things that we talked about are common, but it's never normal. It's never normal for women to leak urine. It's never normal for women to leak stool or feel like there's a ball. And the important thing to know is that there is help. And if that's affecting any aspects of your life, whether it be intimacy, your self-image, how you feel, how confident you feel about yourself, it's time to get help.
It's so good to hear you say that, and I'll state this, but at the end I'm going to say, do you agree? And that is that often women wait until their symptoms are really pronounced to get help. And my sense is one of the things you really want to advocate for is that women get help much sooner. It's simpler procedures, shorter recovery times, and
Absolutely.
life is so much better. There's like absolutely no reward for waiting and suffering more, and there may be a punishment for doing so.
Absolutely. And I think, I mean, I'll add one more point is there is a little bit of misconception. I think women think that, like, because very often I'll hear it. People are like, oh, wait, am I not too young to have this surgery? Or on the other end, am I not too old to have this surgery?
Mm.
And my answer is if you're suffering, and like you said, a lot of the procedures that we do are very minimally invasive. So unless there's any kind of medical contraindication, there's no right age for this treatment. I have patients who are in their 20s and I have patients in their 90s. I have many 80-year-olds who are happily sexually active, and I am so happy for them if I can do anything to help that. And honestly, like that's the best compliment when my patients tell me. They're like, "Oh my God, you changed my life." And sometimes we really do. So it's very, very satisfying.
Thank you so much for sharing on a really important topic in a way that you make it comfortable. You're such a wonderful advocate for women's comfort
Oh.
and ease in this way. So thank you very much for joining me.
Of course. Thank you so much, Dr. Stockwell. I had a wonderful time, and I hope your audience likes it, and I hope they learned something. And like I said, if you ever need us, you know where to find us.
Wonderful. And all those links will be in the show notes as well.
Thank you.